So they had a bill that was going to subsidize health insurance up to 500% of poverty. They also provided small business tax credits, not a large dollar amount, but still in the billions of dollars, that in a 10-year window look like they go away. They'll never go away. Once you start subsidizing, you're going to continue to subsidize businesses into the future. The same piece with the health bill also provided some reinsurance for retirees, for near retirees. That issue too, going to cost money, and don't look at it as a 10-year, $10 billion program. $10 billion this year. Who are they going to add in the other 10 years, in the out years? It's going to certainly go further and further. And again, I still like to stress that absent all this, the biggest, one of the biggest, or equally as big, is the Medicaid expansion, which in some cases are looking at going up to 150% of poverty for all populations. So that's a significant increase. CBO has estimated that 3/4 of the uninsured, a portion of the uninsured are actually below 150% of poverty. So we've got a large group that still would be uninsured that would assume would be under the Medicaid program. So what were the key changes that the Health Committee did? This again gets back to how are they going to drive the cost down into a bill. Well, they lowered the subsidy amount in the second version, so they said 500 may be a little high. Let's go to 400. 400 seems like a good number. And we'll whittle down the amount of the cost that we'll have. Well, guess what? I'm sure as those numbers come down, there are going to be new groups that come out and say that because of the mandate that you've included, we can't afford this. This is unaffordable for my family. So they're going to be back to the drawing board figuring out how do we get the right mix of a subsidy to match a mandate for a policy that's too expensive to begin with. So challenge number one. The other one is once you start offering something like a subsidy or free health care, the danger is you're going to have people who say, I don't like the health care I'm in today. So I'm going to rather go out and buy what is new in the market, whether it's through an exchange, whether it's the public plan that's going to be practically free, or whether it's joining the Medicaid program. Or your employer says, why am I offering all this if the government's going to pick up the tab, i.e. the taxpayers are going to pick up the tab? Why should I continue to offer health insurance to my employees? So the next thing that the committee did said, well, we're going to make it really hard for people to drop their current health insurance. So you are, in essence, being forced to stay in your employer-sponsored plan. They're not going to let your employer drop you. And you, if you decide that you don't like the plan, like if I don't like the plan at the Heritage Foundation, I could leave, you're not going to be able to get a subsidy. So they are creating all sorts of walls so that people don't try to get the subsidy. Why? Because the subsidy costs money. The more people you have leaving employer-based coverage, the higher the price tag goes, the more we're topping off at over $1 trillion easily. And still, as I continue to beat the drum, still no discussion of the Medicaid and how much the impact's going to be, how many people are actually going to end up on the Medicaid program, and what the cost breakdown is going to be. Again, the Medicaid program was intended to cover, in some estimates, up to 150% of poverty. Let's take that as a starting point. Well, the estimates of $500 to $600 billion over a 10-year window to expand the Medicaid program doesn't include the state portion. That'll just be the federal portion. So how are we going to add federal? And now what is the state component going to be? What is the true total going to be? We don't know at this point. So still, the last missing piece is this Medicaid area. Also, the impact isn't that great. It's not like any of these bills reduce the number of uninsured to zero. There are still over half of Americans who will continue to be uninsured. So we're spending over $1 trillion to cover maybe half the uninsured. It doesn't seem to make sense to me. It makes more sense that it seems like we're not spending our money very wisely, and maybe we need to rethink the way we're doing this. Well, in all this dilemma of how much the bill is going to cost, now they've got to find a way to pay for it. So let's look at the ways that the bills are being discussed to pay for it. There are 3 areas: typical tax increases, Medicare and Medicaid cuts, and delivery reform, some of these efficiencies that Greg has alluded to in his presentation. I'm going to run down the list of taxes because there are a lot of them. So let's wonder who's actually going to get hit holding the bag on this. Well, there's the latest version of the surcharge by Representative Rangel, which will increase the surcharge on families earning over $300,000. There's the VAT tax, which is, again, yet another tax on top of income tax. So everyone's going to pay that. That's for everyone. what I like to call the sin tax. So if you drink soda, if you eat at McDonald's, if you eat out of a vending machine late at work, all those things are going to be taxed. There was the thought about looking at employee health benefits, the benefits you get through your place of work. Now, at the Heritage Foundation, I completely agree that the existing tax structure for employee health benefits is wrong, but you don't tax that to give it to people for welfare. If you're going to do an employee benefit reform, it should be going towards tax relief. It should not be going towards expanding the welfare programs. There was discussion about the cap and trade revenue. That's a great one. Let's see what we can, that's why I suspect they pushed it through the House, hoping that if they could get the bill signed into law, there would be revenue to offset the health care portion. The employer mandate. So employers are now going to be penalized if they don't offer a certain type of health insurance to their employees and contribute a certain amount of money to those plans. And then the last one is the individual mandate. Let's not forget that if the federal government is telling you to buy something, you'll have to buy what they stipulate is the right amount of health care coverage. If I have a high deductible, low premium health care plan, it may or may not meet this new standard. If it doesn't meet it, I have two options. I either pay the penalty, getting a tax, or I have to buy up my plan, spending money that I didn't want to spend in the first place. So you're still caught in a dilemma of paying more because of the individual mandate. Now let's look at the Medicare and Medicaid cuts. I think these are interesting. You know, as I think Greg was pointing out, the whole concept of this is to how do we bend the curve in health care. You know, this was part of President Obama's discussion on entitlement reform. How can we fix the entitlement programs? Well, from what I've seen so far, the proposals being put forth are not fundamental entitlement reforms. They're just, again, reimbursement cuts. We go through this every year. Members of Congress go through it every year looking at where are we going to whittle down reimbursements. Are we going to push down on providers? Are we going to push down on hospitals? Where are we going to get the money to come from? So right now, the reimbursement cuts to Medicare are really one of two things. Either a shell game where these groups who have signed on to it, whether they're the hospital groups, the pharmaceutical groups, are saying, well, I'll take a cut here, but I'm going to get major reimbursement on this end. So it's a shell game. They'll get taken from here, show like they're taking a hit, but in reality, they're banking on getting a lot more bang for the buck in the long term. Or it's going to be a temporary fix. All I have to say, and no offense to the physicians in the audience, but the doctor fix is a great thing. Year after year, physicians come back to Washington because of the way they created a formula to cut reimbursements, and physicians are always on the short end of that stick. So they come to Washington to say, your formula's not right, we need more compensation. So guess what? Even though it was signed into law, they were going to get all these savings, they keep giving them back in the long run. The political pressure is very difficult to keep in line. And the last area is this whole concept of delivery reforms, kind of squeezing efficiencies out of the healthcare system. Well, I have two things to say about that. One, they're all unproven. There's not been one study that shows that these things will actually save costs in the long run. The other thing is that they're unscorable. They have no data or research on this, so it's difficult to say how much they're actually going to save in this scheme that's put together. My argument has always been that the reason why they can't show proven savings is because they're not willing to say the truth, which is to get the proven savings, you're going to have a heavy hammer from Washington dictating what people can and cannot get. That is the point that I think is a big challenge. Many in Washington, many of these who are purporting to be fixing the healthcare system, we want everything to work better, health IT, comparative effectiveness, all this sounds great until you realize that it's more all you're doing is spending more money. Well, then where do they get the savings from? It's to actually use those as tools to ration care into the future. And so that's the difficult dilemma that they're in. Many people who advocate for these policies don't want to come out and say, yes, and we intend to use the information we have to ration care, and that is how we will miraculously get our savings. So another dangerous area to go down on. I'm just going to highlight a couple of things that I think right now in closing are kind of the competing visions we have in healthcare today. And this is something that's very important as we look forward to what do we want in healthcare. I would agree that Americans are worried today. Rising healthcare costs, fewer choices, and worried that they're going to be the next one to join the ranks of the uninsured. Certainly there needs to be something done to help fix the problems that we have in our healthcare system. But I think there are two competing visions that are going on right now. From a conservative perspective, I think we need to find ways to empower individuals and families. not to empower Washington and bureaucrats and politicians to decide what's best for ourselves or our families.